Before you get out of bed tomorrow morning, stop. I want you to lie flat on your back and try to lift one leg straight up into the air. If you feel a sharp, electrical shooting pain travel down the back of your thigh and into your calf, you do not just have tight hamstrings. Your sciatic nerve is physically trapped in a vice grip. Your doctor probably told you to just stretch your lower back. Or worse, bend over and try to touch your toes to loosen it up. They may have even prescribed you gabapentin to numb the nerve, or offered a $3,000 epidural injection. Here is the dark truth. Chemical band-aids do not fix mechanical traps. You are just numbing the alarm while the house burns down. And if you have true sciatic nerve entrapment, stretching your back is the absolute worst thing you can possibly do. It is like pulling a rope that is tied in a tight knot. You are just making the knot tighter, causing devastating micro-tears in the nerve itself. Today, I am going to show you a simple 10-second nerve glide. You can do this from the safety of your own bed using nothing but a standard pillowcase. You are going to do this before gravity even touches your spine. This zero-effort movement safely flosses the nerve right out of the trapped muscle. It literally melts that shooting pain before your feet even hit the floor. But you must watch until the end of this video, because I am going to reveal a terrifying truth about your bedtime routine. The specific way you prop yourself up on pillows to watch TV in bed every night is acting like a pair of scissors on your sciatic nerve. If you are tired of waking up in agony, keep watching. I am Dr. Clara, and I am going to show you how to free your sciatic nerve. To actually fix this, you have to understand the difference between a tight muscle and a trapped nerve. The sciatic nerve is the thickest nerve in the human body. It runs all the way from your lower spine, directly through the piriformis muscle, deep inside your glutes. When that muscle becomes inflamed, it clamps down on the nerve like a thick vice grip. Imagine holding a thick, live electrical wire tightly in a pair of pliers. If you try to aggressively pull that wire, you do not stretch it. You just shred the rubber casing. That is exactly what happens when you try to stretch your back by bending forward. You are violently yanking that trapped nerve against the tight muscle. You are causing micro-tears and intense, burning electrical pain. The explanation is the treatment. You cannot stretch a nerve. You have to glide it. Think of it exactly like dental floss. You do not yank dental floss. You gently slide it back and forth to loosen the debris. Before we begin, a quick medical disclaimer. If you have completely lost control of your bladder or bowels, or if your foot is completely numb and dragging when you walk, stop this video. Go to the emergency room immediately. That is a severe medical emergency. This video is strictly for chronic, shooting sciatic pain. Here is why timing is absolutely everything. When you wake up, your spinal discs are swollen with fluid from the night. You have exactly a 30-minute window to decompress the sciatic nerve. If you wait too long, gravity compresses that fluid and locks the nerve in place for the rest of the day. Here is the 10-second pillowcase glide. Lie flat on your back in bed. Take a standard pillowcase and loop it underneath the foot of your painful leg. Hold the ends of the pillowcase in your hands. This acts as a sling, taking all the strain off your core and arms. Now, keeping your knee slightly bent, slowly raise your leg up toward the ceiling. Here is the secret mechanism. As you raise your leg up, gently pull the pillowcase to point your toes down toward your face. Then, as you slowly lower your leg back down to the bed, point your toes up toward the ceiling. Do this opposing motion very slowly, exactly 10 times. This motion pulls the nerve from one end while providing slack on the other. It gently flosses the sciatic nerve directly through the trapped muscle without ever overtensioning it. By doing this in bed with the pillowcase, you effortlessly decompress the nerve before the weight of gravity ever compresses your spine. Now that you have decompressed the nerve, we have to talk about what is crushing it at night. If you are waking up in pain, your sleep posture is betraying you. But it is probably not what you think. It is the dreaded TV-watching bed slump. When you prop yourself up on two thick pillows to read or watch TV in bed before going to sleep, you are placing your body into a severe 45-degree angle. This specific posture acts exactly like a pair of scissors on your lower spine. It forces your lumbar spine into extreme flexion. It drives the jelly-like center of your spinal discs backward, directly into the spinal canal where your sciatic nerve root lives. You are literally pushing your discs into your nerves all night long. You need to sleep in a neutral spine position. If you sleep on your side, you must place a thick, firm pillow directly between your knees to keep your hips from collapsing inward. If you sleep on your back, place that pillow directly under your knees. Take the pressure completely off your lower back. You are not broken. And that shooting pain is not just a normal part of getting older. Your body just needed the right mechanical tools to decompress your nervous system. I want you to try this 10-second pillowcase nerve glide tomorrow morning. The exact second you wake up, before you even get out of bed. Tell me down in the comments, did you feel the sharp electrical pain during the straight leg raise test today? I read every single comment, and I want to know how your nerves are responding. Share this video with a friend or family member who is struggling to walk because of sciatica. I am Dr. Clara. Protect your spine, and I will see you in the next video.